Jessica now introduce herself and tell you about her presentation. Let's give her a hand.
Hello everyone. Sorry about the delay. I had some technical issues. So I'm glad to see you all here. Today, as you can see, I'm going to talk about the evolution of the human face. My name is Jessica Calderon and I'm a member of the Anthropology Club. And I'm also a student at Southwestern College. As a disclaimer, I'm a student at an ESL class, so my pronunciation might not be the correct one in some of the words, but I will try to speak clear for you to understand what I'm trying to say. And if you have any question, I will be glad to answer them at the end of my presentation. Okay, so now let's begin with my presentation. And first, I would like to make it clear that this presentation, although first I choose the name of the evolution of the human face, now we were going to focus only on the evolution of the face of Homo sapiens sapiens, as you may know already. Before us, there were many Homo species, and the evolution of the human face began many years before the appearance of Homo sapiens. So talking about them will be a long talk, and for this talk, we'll only focus on the Homo sapiens sapiens changes. Now, for this presentation, first I would like to give you a brief introduction about what is the human face and what are we going to talk about. Then I will discuss the changes that happen and how are they affecting us. And finally, I will address what might happen to us in the future regarding to our faces. So let's begin with the introduction. So what do we think when we talk about the face? And if we look at the definition in a dictionary, we might find a definition similar to the one that is in the top of the slide, that it says is the front part of the head. That's where the eyes, nose, and the mouth are. But this definition doesn't say why is so special our face. And what makes our faces so special is because it has all of these functions, and it helps us mainly to identify other people, and it also is part of our own identity. It receives information through the senses, and it helps us to communicate even if we don't want to communicate something through our gestures. And it contains part of the vital systems such as the respiratory system and the digestive system. Now, moving on to the changes, we can see the characteristics. I put this image so you can see the comparison between both species and appreciate it more. So our faces are more vertical now and are more rounder in our school, and we had a forehead and a chin. We don't have a robustness, and we don't have a protruded jaw, compared also to a chimpanzee, for example. And we also don't have hair in our faces, usually. So on the changes that happen in the jaw, we can see that the change that happened in the mandible, that is the bone that forms the jaw, it's more of an L shape. The angle in the mandible changed. So before it was kind of soft and rounded, and now it's more of an L shape, and the mandible reduced its size. So now it's small. That's why it's not that protruded. And the teeth are tucked under the face, so they are on front of our faces. And these changes affected our anatomy right now and are affecting our health also. So We can say that we lost the snout. Most of the mammals have a snout. This is the snout. And this helps, the purpose of having a snout is to obtain food without their hands, but humans can't do that. They can obtain food with their hands, so they don't need it. And losing the snout allows us to have more expressions with our faces. Plus, without having the hair, then our expressions were more visible to other humans. This also implies that the food that we were eating were food that was more softer. Because we were using fire to cook our food, that means that it wasn't hard and tough food that we need to chew a lot. So it was soft food, and it keeps being soft food right now that we continue to eat, and that is continuing to make changes in our faces. So this is a change that began in the past, but it keeps on until today. And now our faces have two important changes. First, the muscle that help us to chew on. We have several muscles that help us to chew, but this is the most powerful one, and this is called the masseter. In modern humans, is less developed. And our cheekbones, that are also known as zygomatic and are formed by zygomatic arch, are also smaller. So those are changes that happen in the faces of modern humans because of the change in the consistency in our food. We also changed the type of chewing. Our type of chewing now is more of a grinding type. And these change our teeth. Now our teeth, our front teeth, are less bigger than before. So our incisors are smaller, and our molars are the ones that are getting big. This has led to several problems. One of them is dental malocclusion. So dental malocclusion happens when the sizes of the teeth and the jaw aren't equal. In this case, the jaw is smaller than the teeth. So our jaws are continuing to getting smaller. Also our teeth, but they are slower in the process. So the jaw is smaller than the teeth, and this creates crowding of the teeth in our mouth. And we can see a picture here of how it looks, the crowding of the teeth. And this creates an incorrect alignment of the dental arches. This may seem only that this will be the only problem, but this causes an increase in the temporomandibular joint. So your mandible is going to be linked to the rest of your head through this joint, and you can see that over here. This is your jaw, and this is your skull, part of your skull. So this is the part where it is joined. And dental malocclusion, or crowding of your teeth, will keep on increasing the pressure in here. And that is going to cause pain, and is going to cause difficulty eating, and at the end is going to increase the risk of tooth decay. Now, if this continues to happen and is not treated, this can cause changes in the muscle that I just mentioned. So if you remember, the masseter muscle that is in the sides of our faces, we have both, one on each side. So we have masseter hypertrophy, and this means hypertrophy means that it will be an enlargement of the muscle, and malocclusion is one of the factors that can cause this increase in the size of this muscle. Another factor is bruxism, clenching, or disorders of the same joint that I just explained to you, the temporomandibular joint. So this could lead to changing the shape of the face if it continues. Now, on bruxism, just so you know, bruxism, maybe you have heard of bruxism, or it's something I think more common, but it's when you grind or clench your teeth, and this can happen when you're awake or when you're asleep. And it's more common when you're awake, but there are more studies when you're asleep. And usually the part that is more affected are the teeth, but they can also affect the masseters if it's too severe. And the factors that contribute to this grinding and clenching that continue to happen are stress, alcohol, caffeine, and smoking. So it's not that they cause bruxism, not because you consume caffeine that means that you are going to have bruxism, but if you already have bruxism, they might increase the frequency of your bruxism. Okay? Does that make sense? Okay. And then if it increases the bruxism, you may develop masseter at the throat. Now, another change that has happened in the faces is because of the change of feeding babies. Now, the most common way to feed a baby is through formula, and this can alter the face of a baby because breastfeeding helps to shape the face of a baby. When you breastfeed a baby, the baby doesn't suck only on the nipple. So normally it will suck the nipple, but it also sucks on the surrounding tissue of the breast. And this helps to put pressure on the mouth. As you may have noticed, if you have little sisters or brothers, or if you have ever been in contact with a baby, babies are really, really soft and really moldable. So they don't have their bones, they don't have the bones ossified. Their bones aren't joined together. So this part of their life is really important for them to have mold, the right mold in their faces. The surrounding tissue of the breast helps to put pressure on the inside of the mouth, and this elevates the palate and puts the tongue in a neutral position. So this helps the baby to have the right palate. The contrary, when the baby is fed by a formula in a bottle fed, the baby doesn't have this surrounding tissue. So it's only sucking the bottle, and the tongue can go in the back. So it's not in a neutral position, and it doesn't have this pressure in the hard palate. So we can say that the breastfeeding or breastfeeding a baby molds the mouth of a baby, and feeding a baby with bottle and with formula affects the jaw and the hard palate. We have two palates because it may be confusing. We have one that is made of bone, and this is called the hard palate, and we have another one that is soft. So if the hard palate position change, or the morphology of the hard palate change, then the soft palate will also be affected. And that can cause pediatric sleep disorders. And it also causes changes in the face. And we can see that the changes in the mandible is that it doesn't develop, it's an underdeveloped mandible because there's no enough strength. So a baby needs to put on more work to suck on the milk from a breast than the work that puts on to get the milk from the bottle. It's more easy, so they don't use a lot of muscle and they don't develop a strong mandible. And the arches, the palates, it's more narrow when they are fed from a bottle. So it will look, normally our palate should look like this, that it's wider and shallow, and for a baby that is fed from a bottle, it will look like this. Okay, it's like more small because it didn't have the tongue in the right position and it didn't have the tissue of the breast putting pressure in that place. And this is the same girl, but it's the changes that she went through after getting treatment, dental treatment. But she was fed from a bottle, from formula. Okay, so moving on, those were the changes mostly in the mandible and in the mouth. But moving on, another structure that was affected is the eustachian tube. And maybe you know about the eustachian tube, or maybe you don't. So this tube is the one that connects the middle ear, the nose, and the mouth. And these links, as you can see here, it has two parts. One part is made of bone, and this is the temporal bone. And the other part is made of cartilage. So it usually is closed. This picture is only for illustration purposes, but normally you wouldn't see the opening of the eustachian tube. So the eustachian tube goes to the middle ear and then goes also to the back of the nose. And normally it's closed and you wouldn't see that, you wouldn't see the opening. But it has three main functions, and that is that regulates the pressure inside the middle ear. It helps to protect the middle ear from the secretions of the nasal cavity, so that those secretions don't go up to the middle ear. And it also helps to drain the secretions in the middle ear to the nasal cavity. Okay? And we can see that it works as a flask, so it has pressure on both sides. And if a secretion goes in the neck of the flask, because of the pressure there is in the middle ear, then it won't go up. The secretion won't go up to the middle ear. It's going to be stuck in the neck. And that is why it helps us to protect the middle ear. It opens when we swallow something, and it also opens when we yawn, when we are tired and we yawn. So the change that happened in this case is because our face got a lot of flat. We lost our protrusion in general. The position and the size of our eustachian tube changed, and the ones that are most affected, once again, are the children. So because of their faces are still growing, their eustachian tubes are shorter and are more horizontal than the ones that the adults have. And you can see in the illustration that in here it's almost horizontal, the connection to the ear, and in here we can see an angle. So normally an adult that is upright will be an angle of 45 degrees, but in an infant it's almost 10 degrees. So it's a lot of difference, if you may say. And also, since it's shorter, the pressure that it needs for the liquid or the secretion of the nasal to go up or to go to the middle ear, it's going to be less. So they don't need a lot of pressure for those secretions to go to the middle ear. That's why they have more ear infections than the adults have. And when they are fed laying down, that also takes out the gravity and increases the possibilities of ear infection. So those changes are something that keeps on happening and also affect them when they fly in an airplane, because we already saw that the eustachian tube help us to regulate the pressure, right? So that's why we have to chew on a gum or swallow when we are on an airplane to liberate the pressure that accumulates on the middle ear. But we can do that because our eustachian tube is more functional. But children are different. They don't have such a functional eustachian tube. Now, another change that happened was that our larynx descent, and this has led to different problems, but what is important to notice here is that this change led us to separate the soft palate that I mentioned before. We have in here the hard palate and the soft palate, and there is a separation. So before, or in other species, in other animal species, it's joined to another structure, and this structure is the epiglottis, and this helps other animal species to breathe and to eat at the same time, but we cannot do that. So we had this change, and this originates in a space that is called the oropharynx. And the oropharynx is right behind our mouth and right up in the upper part of our upper airway. This allows us to have our speech that is characteristic, and no other animal species have this speech as humans do. But it also, as you can see from the image, we also narrow our upper airway. So it's a lot of, we decrease the space where we get the airway. And we can see how if we breathe, we get the air through the nostrils and pass to our trachea or through our upper airway. But if we swallow, then our soft palate acts as a block, and then we don't get the air inside of our oropharynx. And we also have the epiglottis that blocks the upper airway, so we make sure that the food gets right through the esophagus, and that is why we don't get food in our upper airway. That is how it works. But this also has led to complications. So because it's such a small place now, now we have another problem, that it's the adenoid hypertrophy. So adenoid hypertrophy, if you haven't heard of adenoids, are structures that are in the back of the nose, of the nasal cavity, and these are the adenoids and these are the tonsils. So in this picture you can see the tonsils that are enlarged or inflamed in both pictures, and when they grow, as you can see, they can cause an obstruction in our airway. The adenoids and the tonsils are lymphatic tissue, so they their purpose is to protect us and to combat infections and allergies. So they are increased when we are exposed to infections like bacterial infections and viral infections, and when we are exposed to allergies. But in adults, they can be inflamed because of gastroesophageal reflux, and that means that the content of your stomach is going to return through your esophagus, through your throat, and that can inflame your tonsils or your adenoids. So if this is chronic, if this continues to happen, the exposure to infection and allergies, this can change your face. So maybe you know someone who has allergies, severe allergies, and you can see those changes in that person. So the nasal obstruction can cause mouth breathing because we can get the air through our nose, because the air passes through here, so it's reduced the place where we get the air, and then we are forced to breathe through our mouth, and breathing through our mouth can cause a long lean face, an underdeveloped upper jaw bone, elevated nostrils, because we're trying to get more air through our nose, and crowding of the front teeth. And usually, the people who have allergies have an open mouth. Okay, so this is one of the conditions that can cause the obstructions that can cause allergies, but we also have obstructive sleep apnea. So because of our anatomy, because of the changes that we have, we also have obstructive sleep apnea. So now it's being diagnosed most than ever, and we have seen more cases of obstructive sleep apnea, and it's when you stop and start breathing during your sleep. So in this case, there is a pharyngeal closure during your sleep. Your muscles in your pharynx relax, and your pharynx collapses during your sleep. And there are a lot of factors that contribute to this condition, but primarily our anatomy is one of the causes that contributes. It makes us more vulnerable because we have a small airway, upper airway. So our tongue being in the back, and if we have also a small mandible, or if the person also has obstruction because of the tonsils or allergies or obesity, that can also contribute to developing obstructive sleep apnea. But this is a complex phenomenon, so it's not easy to pinpoint just one cause as the cause of the disease. Finally, on gaining a forehead. So as we may know, or as you may know, we got a big brain, and so our brain increased, and this contributes to the verticality of our faces and us getting a forehead. And this ultimately reflects that we got more cells that create the outer layer of the brain. So the outer layer of the brain is named cerebral cortex, and this cerebral cortex was so big at one point that it started to fold itself inside, and that made this characteristic shape of the brain. So this is just a picture for comparison. So you can see, and it's not, it's obviously It's not the same size. So a rat brain is much more smaller than a human brain, but you can see the difference from the cerebral cortex from a rat brain, that it's smooth, that doesn't have those folds that the human brain has, because of our cerebral cortex is big, so it has to fold itself to fit in our cranium. And also having a bigger brain size and a cerebral cortex that plays a role in making decisions allow us to develop our language, and part of our language is having the facial gestures. So we have muscles that participate in the facial expression, and all of these muscles are symmetrical, so they help us to create different expressions, and they can also be affected. We have the face palsy or Bell's palsy, if you have heard of that name. That is when there's weakness to one of the sides of the faces, of the muscles of the faces. But usually this is temporary, so it lasts just for days or weeks, and then the person that suffers from this condition starts to recover. And it's usually associated with inflammation of the nerve that controls the muscles. Most recently, it's been associated with infection, especially with herpes, if you may have heard of that virus, herpes virus, that one that causes cold sores in the mouth, and also with diabetes or high blood pressure. So what is characteristic is that although it may look like this side is the one that is affected, is usually the other side, because we're talking of palsy, so they don't have the ability to move their muscles on this side. So this woman is trying to smile or to move their muscles, but because she can control the muscles on the left side, then there's an overcompensation on the muscles on the right side. So that is why she looks like this, but this side is the one that she can move, and this is the side that she cannot. And we can see a difference in face palsy and acute stroke. So both affect the muscles in the face, but they affect it differently. So this man has face palsy, and this man has weakness of the muscles because of acute stroke. So both of them are trying to smile, but we can see here that he doesn't have any expression on the forehead, on the right forehead, and also doesn't have any nasolabial fold. And the eye is also affected. So sometimes we forget that the eye has muscles around, but it also is affected. So we have the people that is affected by this palsy can close the eye when it's too severe. On contrary, the person that is affected by acute stroke has a little bit of the nasolabial fold, but it's just not as marked on one side as in the other. So it's just the weakness that it has. And you have to consider that depends on the severity of the stroke, because if the stroke was a small stroke, it may not affect all the face, or it may not be so noticeable. But if it's a big stroke, it may affect not only the face, but it may affect the whole body. Okay? Usually, what you see in the face palsy is just the face doesn't move, But in acute stroke, you see the face dropping, like the muscles drop. Not that they don't move, they mouth and the eye, you see them drop down instead of not moving, and inability to speak. Okay, so that is everything that I wanted to say about the changes. There are a lot of other changes that happen and that are affecting us, but those are the main ones. And now moving on to the future of the face. So now we have plastic surgery and face transplants. So plastic surgery first began with small changes in the faces, and now we have seen how that has changed and is increasing now. But overall, it's transforming faces. And now we have the ability to do face transplants thanks to the technology and the medicine. However, both of these changes are, unfortunately, if you may think so like that, are changes that are just happening on the outer part of our body, and these changes aren't happening on the genes of the human. So both of them are going to continue down the evolution of our generations. So they are going to only be changes that happen in the person who had the surgery or the plastic surgery or the face transplant. What may happen to the face is that we may see in the future an homogenized face, human face, because of globalization and now people moving to different places and migration. We have seen that there are more people that are marrying to different people from different countries. They are not staying in the same place they were born. So we may see a face that is more mixed and more similar in characteristics overall. And also, in respects to the genetics of the face, science is continuing studying more about the genetics of the face. So we may have discovered more about the genetics, more genes associated with the face, or in the changes of the faces. A future where the genes may be something where we can change the genes and alter the face of the persons. It's something really, really far away, so that may not happen in the next years. But we may associate some genes of the human face with some diseases, or we may associate some genes with some psychiatric disorders. So that is something that the genetics of the face are looking into, and that will be an interesting field to go in. Okay, so that is everything on my part, and if you have any questions, I will be glad to answer.
Okay, guys, go. Have no questions.
Or opinions, if you have any opinions about it.
I do have a quick question. You mentioned from like the ear canal to the nose,
Yes.
in babies is different, and that's why they struggle in planes. Do you know at what age it starts like
To change?
Yes.
Yes. Usually the changes begin after I think it's after the 5 to 7 years that we see the changes, the growth in our school begins to change. And I really like this picture because it shows the location of our ear, like how it is different. So yes, around approximately. Any other question or comment? I would like to hear.
There is one right in the back.
Oh, yeah.
Yeah, so does the general malnutrition, since also like breastfeeding helps shape the face of like a baby, does that continue into like when they start eating solid foods, or is that
Yeah, actually, that also plays a role because we didn't only change breastfeeding and bottle feeding. We also changed feeding babies or weaning babies. That it's when you take the baby out of the breast and give them the food. So we changed that from little coarse, just food that was a little bit coarse or raw to food that is super soft now. So you see the food that for babies are super soft. So that also plays a role in keeping the mandible and the occlusion or the crowding going, that process ongoing. So yeah, that continues because the growth keeps it's still ongoing. So um, it's going to continue on that process. And if you change the diet, maybe if the baby or the child, in the case that already has teeth, it begins to chew a lot more food, then maybe it could help to develop a stronger mandible or a stronger masseter and reverse a little bit what it didn't do when it was bottle fed.
Anyone else?
Yeah.
I know that manufacturers now have changed the middle of the bottle to make it more like
The breast?
The breast, but does that even help at this point? I mean,
Well, unless it's a human breast.
I know, but they claim that they changed it too, because I've seen them and they look completely different. than
Yeah,
what they
probably.
were
I haven't seen them, so I can assure you that they don't do the same thing. But probably they won't, because it's the human breast, it's the pressure of the flesh, the ones that shape the mouth, the inside of the mouth. So it maybe have the different shape, but it probably won't have the same pressure because you won't do you aren't going to put on the pressure with an object, right? So it's a natural process that happens when you breastfeed a baby, and they already know how to do it. So I don't think so. I think it's similar to what happened with formulas and breast milk. Like a lot of companies used to claim that formulas were exactly the same as breast milk, but they never were. So yeah, I don't think so. Probably they won't be the same. Yeah.
I have question, suggestion, opinion, what have you. Because when babies have recurrent tonsillitis media, miliary infection, that could result in their infection actually reaching their eardrum and causing problems in the long run, such as loss of hearing and so on.
Yeah.
Okay. Now, the connection here that I'm making is in between the position of eustachian tube and the soft palate and breastfeeding. So due to the fact that the bones are being formed and are forming as we develop, maybe the position of the soft palate also influences the position of eustachian tube over a period of time, which results in more frequent ear infections that result in more frequent possibilities of baby losing hearing, and everything goes back to the original feeding mechanism, which is quite scary. So what are your takes on that?
Yeah, the position of the eustachian tube is related to or is tightly related to the position of the soft palate. Because if you see here, so this picture, this little opening will be the opening to the eustachian tube, and this is the soft palate, and you can see that. And I didn't mention because it may be too overwhelming, but the muscle that opens that the eustachian tube is connected to the soft palate. That is why it opens when we swallow or when we jump. So yeah, it's tightly connected. And as we saw first, the being breastfed or being bottle fed change or can change and impact in the position of the soft palate. And a dysfunction in the eustachian in the eustachian tube can cause an increase in ear infections, even if you are an adult. So as a child, you may have more ear infections naturally because that is just the anatomy, the way that it works. But if you have a dysfunctional eustachian tube, that may continue to happen even if you are an adult. And ear infections are a pain. Another question or comment?
Yes, I am curious. Near the end, you were mentioning face operations, and you mentioned face transplant.
Yes.
And my question would be, what is a face transplant?
Yeah, face transplants are part of the plastic surgery or the plastic and reconstruction surgery, and those are the transferring tissue from the face from one face to another. So that is what is face transplant. So they transfer the tissue from different face to another face. That is what is now a face transplant. They involve more things because there are face transplants that are only about the skin. If the person had a cancer in the skin that it needs to be repaired or took a lot of the tissue. But in this case, in this particular case, the person had a deformity in the mid-face, so it involved also reconstruction of the mid-face, and they involved that part, reconstruction, the mid-face, and as you can see, she didn't have a nose, so she was breathing through this tube right here and being fed through this tube, and they helped her to get a nose with the shape that we are familiar with and functional mouth. And that is an extension or the evolution of face transplants. That is why they have been changing now. It's not only giving them a new tissue, but also creating the structures that they don't have. Does that answer your question?
Thank you.
Yeah. So anyone else? Or a comment? What you may think about the future?
Oh, I think you go first.
Oh.
I do have a question about the future of the brain. So you said that our skull started getting bigger and bigger to fit the brain, but then it came to a point in which the brain started folding inside the skull.
The outer layer of the brain.
Right.
Yes.
So in the future, instead of having like a really long or big head, are we just going to have a more wrinkly brain?
Well, the size of the brain did increase, and we did get this shape, but I don't. That is just my personal opinion, right? I don't think we're going to get a lot of more. A bigger a bigger cortex, right? A bigger cerebral cortex. The one that we have, I think that is the one. But it may be possible. It may be possible that if we continue to develop, there is a need for us to have an increase in capacity, in mental capacity. Then we may need to increase our cerebral cortex, and that might happen. But I honestly, I don't see that happening right now. But because we are depending a lot on technology, so we are like leaning towards the other side of that. Like, but it may happen. So that could be a possibility, because if we get if the environment asks humans to have more intelligence and then a more critical thinking, then the outer layer of the brain will need to grow. And the only way for that to happen may be getting more faults in our brain, and also maybe a bigger cranium. Maybe we will grow. That's a possibility in the future, long future. That might happen.
Anyone else?
Oh, is there any possibilities that there could be damage on babies that experience more pressure shifts in the eustachian tube? Like a baby that goes in planes more often than one that doesn't? Could there be any like long-term damage to the baby that feels pressure more constantly?
Yeah, that for sure can happen. So because they don't have they may don't know how to regulate the pressure, and they don't have such a functional eustachian tube. If they are exposed to these long travels in the airplanes, they may have the middle ear may be affected. So not only infections, but the tympanus may be affected, because they can regulate. We know that if we feel something weird in our ear, we may swallow or try to yawn or put pressure in our mouth. But babies don't, so they only cry most of the times, and they don't have yet the intelligence to notice those changes, and they may have consequences. Yeah, that might happen. But that, I don't think that is something that is considered yet for the airlines. Yeah. Another question or comment?
Okay, you guys then.